All right, so we're going to go ahead and get started. If on your image it says Nathan Nagy, I am not Nathan Nagy. My particular account was not working, and so I'm under one of my colleagues, actually one of our employees here who helped us set this up. So Nate gets a great big shout out for helping bring this together. So I'm pleased to join you this afternoon. My name is Dr. Kenneth Olson. I am a chiropractic physician. What I am not is a coronavirus expert. I'll not be able to answer all of your questions today, but certainly we want to get in front of as many people as we can to let you know kind of the state of affairs, give you a reasonable mindset of what's going on with this virus, how it's impacting healthcare, and how it's impacting both locally, nationally, and then globally as well. So we'll do our best to provide known basic points, clear up some common or frequently asked questions, and get you the information that you might be able to start applying today to help yourself feel and function better. So I also wanted to introduce Dr. John Konopalski. Dr. John, can you join here? There's Dr. John. And so Dr. John Konopalski is our doctorate level advanced nurse practitioner that works with us here at Pure Health. And John's going to be acting as the facilitator. So those of you who are on board in the webinar format, not just listening, will have a Q&A button on your control panel. That Q&A lets you type in a question, and then Dr. John can do his best to go ahead and answer that. So Dr. John, you want to share a little bit about your background?
Sure. I am a family nurse practitioner. I've been practicing for over 20 years, and I've been with Pure Health's physical medicine for about 2 years now.
All right. And we love him. John does a great job with us. He handles all of our medical interventions and is a super wealth of knowledge for us. So thank you for being with us, and feel free to go ahead and jot any questions that you might have, and John will get to those as much as you possibly can. So a little background on why we're doing this presentation. John and I got together back in late February, really, starting to look at what was happening with this particular disease. And we said this was going to be a real thing. And certainly that's true. Unfortunately, we were right about that. But we presented our first coronavirus lecture on March 5th. And many people have asked us to kind of update that and give us a perspective of where we're at today. So that's what today is all about. Again, little disclaimer here. The information presented in this program is for educational purposes only. It is not intended to diagnose, treat, nor is anything in the seminar representative that this would help you prevent getting the SARS-CoV-2 virus or being infected or treat it. So I don't want anything in our presentation today to make you think that what we're going to tell you is a treatment or particularly a cure or prevention from the disease. So with that said, let's get into what you might need to know, and those especially are local. I know there's some people online that are from across the country, but those who are here right in Northern Illinois. The Illinois Department of Public Health has asked us to publish these numbers. Certainly on the left-hand side of the screen is the county health departments that are doing screening and or fielding questions. Recognize that Kane County does not have a COVID hotline, nor are they doing testing. They recommend that you contact these Northern Illinois hospitals. We will include these numbers again at the end of the presentation, and they'll be included in a follow-up email after the presentation. If you or a family member are suffering with particular symptoms related to COVID-19, please contact these hospitals for further direction. So a little background on the disease history. Coronaviruses are a large family of viruses that are common in people and also many different species across the planet here, including camels, cattle, cats, bats. And rarely do we see this process called the spillover effect, where an animal can infect a person. What we do see is there is spread between people in both the MERS-CoV, which was the Middle East respiratory syndrome, the SARS-CoV, and now this new novel or SARS-CoV-2 or COVID-19. Experts have said that this is very likely that this particular disease did develop in bats, and somehow there was a carryover there. We'll talk about that in just a second. So a little bit on the nomenclature. First of all, there's two different names that float around here, and I just want to clear that up. So SARS-CoV-2 is the virus, and the coronavirus disease or COVID-19 is the illness. So much like HIV and AIDS, HIV, the SARS-CoV-2 is the virus, and AIDS would be the deficiency or coronavirus disease. So disease, virus. So if you see those names interchanged, that's what you're going to see. COVID-19 was first identified in approximately December of 2019 in Wuhan, China. And early on, many patients at the epicenter of the outbreak had some link to either large seafood or large animal market, suggesting that animal to person spread. By January 1, 2020, that market was shut down. But by then, the virus had already been spread to too many people. And it happens to be that Wuhan is 11 million people. And the timing of this also correlates with the Lunar New Year or the Chinese New Year, which is the greatest amount of travel. And so this is a time where there was really crowded buses and transportation and conditions that are conditions that were really ripe for the spread of this virus. And that's why this thing took off so rapidly in China. Unfortunately, this also led to international exposure. And given that Wuhan has many direct flights to New York, to San Francisco, to London, Paris, Rome, we quickly saw that this was an international condition. And we'll get to the update on that in just a minute. And what we've seen now is not only is there there's what's called community spread, and community spread is exactly what we're trying to battle, which is this ongoing basis that the virus is out in contaminating surfaces. Someone who's not been exposed touches that and now is exposed and develops that. Global cases, so this is interesting. We had updated this approximately at noon, and we like to follow the John Hopkins source here. I'm going to actually click and share their live screen. So recognize at noon there was 454,000 cases. And what I'm going to show you is currently that's grown just in the last little bit to 521,000 cases. And now we're up to nearly 23,500 deaths. You'll get this link in your email as well. I find this is the best site with the most accurate, up-to-date information. On the left-hand side shows by country. One of the things that stands out is US is quickly going to exceed Italy and China, and we estimate that to be within the next day or so. On this taskbar, if you click to admin 2, right where my cursor is, this brings you by state. And so we quickly find out that New York, the state of New York, and most specifically New York City, if we click here, it'll show us that New York City has the greatest number of deaths. And it's really believed that New York City is the epicenter within the United States. And unfortunately, they haven't reached their peak yet. So the peak is represented by this curve down here. Now this is international cases, but even in New York, we're not seeing the peak of that curve yet. And my research experts were saying that could be 2 to 3 weeks away before we even hit the peak of that. So unfortunately, this disease is rapidly spreading and continuing to grow. And our efforts to lower the curve are going to extend the time frame in which the disease grows. Now, narrowing the curve or trying to lessen the curve is an important thing because it decreases the stress on the medical system for those that are chronic and severe cases. We'll come locally here to Illinois, and literally just a couple minutes before I got on the conference here, we got a new update from the Illinois Department of Public Health. And unfortunately, this news release was just now. 673 new cases overnight. And we look down here and it's by race, we're seeing 40% are white, 28 black, and then it disperses from there. But this is the largest number of new cases I've seen since the outbreak, and we're continuing to get new deaths. So this is rapidly growing. Patients ask me all the time, is this as serious as it's being made out to be? And the answer is absolutely yes. And we really need to ensure that we're taking our own responsibility for how this is impacting our world. I'm going to share another screen here with you. This is the Illinois Department of Public Health. And I'll go ahead and update this. Let's see if this works here. Yeah, so we see there's 2,538 cases out of 16,631 tested. Looking at that math, it's about 7.5 tests that are negative to a positive test. Most specifically to us is Kane County. There's now 57 positive cases in Kane County. So right in our neck of the woods, this thing is rapidly growing and is of grave concern. We need to continue our efforts to slow that progression. Go ahead and get back to the main presentation here. So this is the website. And again, you'll get that link in a little bit. That's the site that I just showed you. And then the Worldometer also is another really credible site to get up-to-date information. And then we look at the Department of Public Health, Illinois Department of Public Health, their site. Obviously, this just changed. So that's not quite up to date that we just got that new data. So what are the signs and symptoms related to this? You know, and there's a lot of questions going on regarding how that's affecting us. But the thing to remember is that probably somewhere between 40 and 60% of the population is going to contract the coronavirus disease. And of that, 80% are going to have mild to moderate symptoms. We're really only seeing 20% go into that moderate to severe and/or critical conditions. What are the presentations? Fever is indicated in 83 to 98%. And most specifically, what I saw is in the first 3 days of exposure is where we're going to see that fever spike. So fever is still a good monitoring tool to indicate whether or not you've been exposed to the virus. The next most prevalent condition or symptom is the cough. Usually that's a dry cough. We'll see in a little bit that can get into a deep productive cough. But we're not talking about the upper respiratory sinus stuff. We're talking about deep lower respiratory, which is why it comes into shortness of breath. This will also result in tightness of chest. And then a great majority of patients show the fatigue or just generally not feeling well. And that's very common in virus expression. So the other things that show up, maybe less common, but are still there, pharyngitis or sore throat, headaches, a deep productive cough. We are seeing that the virus can move into the GI system. So tummy upset and some other issues with the GI system certainly are showing up. Any kind of blood in the mucus is important to monitor. And then some are showing neurological signs, including nausea and vomiting. So we are seeing that while it's being mainly reported as a lung condition, the coronavirus can move into the nervous system and introduce neurological disease. So this is a big risk factor for the advanced and more critical illnesses. These less common symptoms include that pain and pressure in the chest, loss of colorization to the lips, new confusion. So just not being very acclimated to time and space. I found this interesting. There is some really decent research that was just published regarding conjunctivitis or pink eye. So it's believed that sometimes if this virus is picked up on your hands and you rub your eyes, it can present early on as conjunctivitis. So that may be an early thing to monitor. And then the most common question I've gotten in the last few weeks, maybe even just in the last week, is, hey, I heard it can result in loss of smell. Is that true? So we dove in and looked at some of that research, and an ear, nose, and throat study out of England definitely showed that there is a prevalence of mild cases that really only presented with the symptom of loss of smell or loss of taste. So both conjunctivitis and that loss of smell may not progress into advanced disease, but these are believed to maybe being carriers. Those have low expression of the illness, but are infected and then go ahead and infect others because they think nothing's wrong with them and don't take the precautions to self-isolate or social distance. So that's an important thing to note. A warning sign: when do you need medical attention? And I also want to highlight on here, if you go to the CDC website, they have a great new interactive tool that's a patient screener. So go to cdc.org and you can click on the patient screener. It'll walk you through the decision-making of whether or not you need testing and or medical intervention. But certainly the warning signs are that trouble breathing, persistent pain or pressure in your chest, new confusion or inability to really get your energy up, and then the loss of oxygenation to the face, so blue and blue lips and face. So how does the virus spread? A common question that's been coming up as well is this an airborne pathology? And most believe that no, it's not. The virus is too dense and too big to really live and travel throughout the air. So if you're just in an area where you're breathing in air, it's very unlikely that you're going to get the virus. But it is in what's called respiratory droplets, which are what's projected in an aggressive sneeze, a cough, if somebody wipes their mouth and it's on their hand, or gosh forbid, picks their nose or something like this, and then touches a surface that you may then become in contact with, that's where that virus can live. And varying studies tell us that that virus can live on surfaces for up to a week. And so it's really important that we're watching what we touch, and we'll get into that a little bit. But these respiratory droplets, the virus can travel through the air. It's believed to stay in the air maybe 30 to 40 seconds. And one of the studies that I read, or an article that I read regarding, is this an airborne pathology? It says yes, but most significantly in the event after aspirating or after intubating a patient or after doing the test, when there's a deep projection of respiratory volume, that's where the droplets come out. So in our common spaces, this is why that 6-foot social distancing is important, so that we're not coming in contact with somebody else's respiratory droplets, and then decontamination of all surfaces. So one of the things I'll remind people of is that we come in contact with a lot of different stuff. So make sure that you're washing your hands. We'll touch on that in a little bit. What are the risk factors? First of all, your date of exposure, you may not see symptoms for up to 5.2 days. That's the mean. So some show symptoms a little bit earlier, but you can be exposed and not have symptoms for several days. How long does the illness last? On the mild cases, the average has been 4.6 days. On the more severe cases, it's 12.5. I know some people had brought up the Princess Cruise Line, and that some of those people were sick for 17, 18, 20 days. And yes, in the severe cases, in isolation and containment where there's a high volume of virus, that's reasonable. Another reason that practicing social distancing and stay-at-home orders and these sorts of things are important. Why this virus is spreading so quickly is that each person who's infected is expected to infect at least 2 other people. Now, again, the data outside of China shows that only serious illness is going to happen in about 16% of the cases. And unfortunately, we're going to get into who's at greatest risk, but older people are at greatest risk. We just saw from that Illinois Department of Public Health news release, they confirmed that most of the deaths are over the age of 65, and then with complicating conditions, and most of you have already heard that. So scientists indicate that your risk for significant infection increases 3.5-fold if you're a cancer patient or under cancer treatment. Those with lung disease, it's 2.6, and those with diabetes and hypertension, about 60%. The note here is oftentimes we believe we're healthier than we are. And so we may not really realize that there's some underlying kidney issues or underlying blood sugar issues or hypertension until we're introduced with another stress to the system, such as a virus like this. So I encourage you to really monitor your own health and take serious that this thing could have an effect on you. Based on the available information, again, those who are at greatest risk, 65, living in a nursing home or long-term care facility, visiting these areas certainly is all restricted at this point, but use great caution if there's any reason that you have to go in that environment. And then, immunocompromised, and one of the interesting stats here is those with a body mass index over 40 are likely to have greater stress to their renal system, to their livers, and that might also put you at risk. There was a note from the CDC to really monitor expectant mothers. It's not known to have an increased risk, but certainly there's 2 lives at stake versus 1. We all are in an area where COVID-19 is now spreading, so we're all at risk. The good news is those younger people are at less risk. 2.1% of the infected out of the total infected database from China were under the age of 21. And we're seeing very similar numbers in the United States. Again, most people experience mild illness. So what about testing? This is a really rapidly changing area, and we've all seen through the news this test process. I think this infographic's pretty interesting, but the basic test is this nasopharyngeal swab. So it's a deep Q-tip that goes into the nose to draw mucus from the throat. This is then cultured, and as it's cultured, they look at the cell makeup to see if that cell has the RNA factors. So this particular virus latches on to your healthy cells and takes over the inner machinery of the cell called the RNA. And that RNA then will duplicate and tell other cells to release more virus. So this particular testing isolates, so it's called the RT-PCR testing. It's a little bit labor intensive and has to be cultured out to a degree to determine the amount of RNA in those cells. This is great testing for the acute phase. The unfortunate part about this testing is it's labor intensive, it's equipment intensive because the healthcare provider has to be in their full protective equipment. And it takes a little bit of time to determine the results. And then the most vulnerable thing about this test is it has 60 to 70% sensitivity, which means there's 30 to 40% negative tests that actually could be positive, that were exposed or truly have the virus. Which leads us to what's right on the horizon. There is going to be new testing that will be out very shortly. In fact, the FDA is pushing these tests through very quickly. And it's tests to determine your immunity to the disease. So when your body's infected, it goes through a sequence of process. The body's response is very specific and will start to create defense mechanisms, including antibodies to the virus. The initial antibody response is called an IgM response. And this will happen in as little as 3 days. We'll start to see that your body's creating antibodies. And that's why 80% of people only have mild symptoms. They're exposed to the virus, their body starts their natural healthy defense mechanism and builds antibodies to it. Longer down the road, when we see an IgG response, we know that there's true proven long-term immunity. And this is what immunizations go for, or vaccinations go for. Currently with COVID-19 or the SARS-CoV-2 virus, there is not a vaccine. And what's interesting is very likely that vaccine is going to be too late to market, because the rate of exposure is going to be so much that most people will have IgM markers. So if we can test for these IgM markers that would progress into long-term immunity, there would be no need for vaccine, because you've already been exposed and you've already built your own body's tolerance to that disease. A note for our patient base, we're very closely monitoring this. It's a potential that we'll be able to provide the blood droplet testing here within the next week to 10 days. So stay tuned for that if you want to check and see what your IgM markers are. The reason that this is important is to understand how many people have truly been exposed to the disease and how many people have immunity. When we look at the herd immunity, what that means is enough people have been exposed to the disease that the disease stops rapidly spreading. So it'll allow us to get back to our normal routines. The interesting part about this as well is it would offload some of the stress on the healthcare providers, because those who've already been exposed and already have the antibody markers would not need the personal protective gear. They're already protected against the illness. So stay tuned on that. It's rapidly changing, and we're excited to kind of keep track of that and see if we have an ability to help you know your immunity to this. So the name of our presentation is "The Best Defense is a Strong Offense." And oh, you know what? I want to go back and handle one other question that comes up, which is your blood type a risk factor? And that's been a really interesting question. I looked at the study that presented this, and it was a pretty small sample base. So it really only took like 3,000 cases out of China. And then it compared the percentage of infected people compared to the random blood types in a general sampling. And yes, there was some indication that type A blood had greater exposure. There was a greater propensity to see that in the infected population versus O, but it really wasn't very definitive. So I would not rely on that information until there's more widespread study. We need a much larger sample base to understand that. So if you're an O blood type, don't think that you're immune to this. And if you're an A, don't stress. I don't think you're at a significant statistical difference. And we'll just have to wait and see what that research tells us. So your best defense is a strong offense. Certainly we are well informed on these practices that we need to do. The stay at home, especially when you're sick, but even now, you know, we're under this stay at home order. It's really about to minimize the interaction and this travel between people. Clean your hands very consistently. Clean and disinfect objects that you touch. I just want to highlight a couple objects. Number one is your cell phone. All of us have cell phones and we're on that all of the time. We're touching a surface on our phone. So please consider wiping that down with an alcohol wipe. Most of the newer model phones are water resistant, so you can go ahead and wash those down with soap and water. Another thing to keep in mind is like the grocery store. So things that were highlighted to me are ATM pads or the keypads, gas stations, things that are touched that we may not be really cognizant that may be infected. And then this is a new discipline for me, and I probably have already done it several times during this presentation, but avoid touching your nose, your eyes, or your mouth. The number says that we touch our nose or our face 90 times a day. So be aware of that. Sanitize your hands and wash your hands as frequently as you can. So here in Illinois, we have this stay-at-home order. You know, this is for the process to decrease the curve or kind of spread the curve out. Most data says that this isn't likely to decrease the overall number of people that are going to be infected, but it is going to spread it out over a longer period of time to make resources more readily available for those who are the moderate to severe cases and even those who become critical. What this order does not prevent are essential activities like the grocery store, receiving medical care, your own health care, and then getting outside and being out in a outdoor environment. So you can do that. This is a tip that was on the CDC. And just to remember, again, the grocery store, this is an interesting place. It's very curious to me. There's no regulation of who goes in and out of the grocery store, whether they're sick or not sick. And then everybody's touching every surface. So I do think that it's necessary that they stay open, but I'm going to stress to keep really healthy practices with hand sanitation, hand washing. If you prefer to wear gloves, I think that's a good idea, but they should be disposable gloves. Don't think that your winter mittens are going to protect you. Those will just absorb that virus and make it more likely that you spread it at a time where you're not considering it, okay? The home stuff, you know, this is where staying healthy means some deliberate planning right now. So as the weather hopefully turns a little nicer here, getting outside, working in your garden, think about, you know, joining webinars just like this, taking a class online, reading books. We got to find activities to keep ourselves busy. So another thing to pay attention to is avoiding additional or unnecessary stress to your nervous system or to your respiratory system. One of the things I hear people doing quite frequently right now are taking on painting projects. And if you're sitting in a closed environment and painting, you're putting stress on your lungs. Maybe just use caution with that. Make sure you're getting plenty of fresh air and you're not stressing your lungs, in which they're more vulnerable to infection. The ask of a face mask. Face masks are for sick people and for healthcare workers. If you're well, a face mask is not going to protect you from this disease, and the CDC recommends not using one. So please be considerate of that. I know we feel that to a degree, there's a lot of people who feel that wearing a mask is going to help protect them. The research doesn't support that. In fact, in some cases, wearing those masks do little to no good. So health in a time of uncertainty. You know, if we're going to stay healthy, there's two options to do this. And one is avoid getting the disease or the virus, which is what we just talked about. And then the second is about keeping your body in the healthiest state it can. So keeping your immune system operating at its highest so that if and when you were infected, your body has a much greater chance of staying in that 80%, which is minimal disease. And so we need, you know, our leukocytes, our lymphocytes, our natural killer cells, our neutrophils. We need these guys to be on high alert and ready to act. And so there's one thing that you can do. It's free. It's safe. You can do it anywhere. And it's probably the most important thing you could do right now, which is sleep. We need 7 to 9 hours of sleep a day, and then 1 to 2 brief naps a day. Sleep is essential to building your body's immune system. And on one particular website, we found that particularly the development of the cytokines really is important in the process of defending against the coronavirus. So get plenty of sleep. Think about trying to get a few naps a day, stack up on those. If you're working from home or aren't able to get out, now is a great time to get caught up on your sleep. The second thing is hydration. Water is super critical. The general rule of thumb is you need 8 glasses of water, but more specifically, take your body weight, divide it in half. That's the number of ounces of water you need every day. And it's undoubtedly the most essential nutrient, and without it, we die. So dehydration just puts a tremendous amount of stress on your immune system and on your nervous system. So if we're dehydrated and then get sick, it really can complicate things. So think about adding water to your regimen at this point. Healthy eating. You've all heard some of the guidelines. I'm going to stress a couple of very important points here. Certainly a variety of foods and nutrient density foods are really important. My primary recommendation is this: avoid sugar, avoid processed foods, avoid fried and fatty foods. And I think there's no better time than now to initiate that healthy eating plan. So many people who've talked to us tell me that they don't have time or can't cook or it's too time consuming. You have time now. So start that healthy eating plan. Look at a variety of good proteins, lean meats, essential fatty oils. So good healthy oils are good. And then be cautious about some of these things like the saturated fats, the trans fats, added sugars, especially those sugary drinks, alcohol consumption in moderation. Too many people are telling me, I have nothing else to do, so we start happy hour at 2. Be cautious of that. And then lastly, watch the excessive caffeine. Another disclaimer, I'm simply providing recommendations for supplementation because people so routinely ask us what supplements help support their immune system. These supplements are not to prevent the virus, to prevent SARS-CoV-2, to treat COVID-2, to treat coronavirus. We're just simply providing supplementation recommendations that I routinely do for immune support because it's such a frequently asked question right now. So the number one that I always go to is vitamin D. Vitamin D helps boost your immune system, especially during cold and flu season. And low vitamin Ds did show that it increases your likelihood for cold and flu. I recommend at this time 10,000 IUs per day, especially as we don't see the sun and don't get a lot of natural vitamin D right now. Vitamin D is super, super critical. Zinc is another option. Zinc, what we find, especially in the Midwest, and this study was in Detroit, 30 to 40% of our elderly surveyed or tested had mild to moderate zinc deficiency. Well, this particular virus, especially in the nasal cavity, is responsive to zinc, and it slows its ability to adhere to your body's own cells. So, zinc is important. I recommend zinc lozenges, or if you're supplementing zinc as part of another multivitamin, that's good. So Coldies or Zicam are good zinc lozenges or supplements, and then there's other zinc lozenges over the counter. Vitamin A really is important in immunity, especially in helping your body build both T cells and helper T cells and help you get those antibodies built up. So, the carrots, spinach, and dark green vegetables, pumpkin, tomatoes, cantaloupe, beets, grapefruit. Some cheeses are loaded with vitamin A, and then broccoli. I also recommend vitamin A as part of a supplement as well. And then vitamin C seems to get all the glory. Everybody's heard about vitamin C. The one thing I don't want you to do is go stock up and start drinking a bunch of sugar-laden orange juice or, orange drinks. Orange juice is fine. I'm not saying not to do that. But really to get a good nutritional supplementation for vitamin Z. There was some new information out of New York City. Some of the hospitals in New York City are now treating or trying to help the moderate to severe cases with intravenous infusions of vitamin C. So it'll be curious to see what their outcome is there. This is an area we're closely monitoring and looking for options to help patients as soon as we have some greater clarity and ability to maybe administer that, we're going to be launching that in our office. And then lastly is essential oil of oregano. And essential oil of oregano is known to be an antioxidant, antiviral, antimicrobial. Those of you who use essential oils may have something that is an essential oil of oregano. We happen to recommend a product called ADP, and ADP is a concentrated essential oil of oregano in a tablet form. So that's that. So our particular recommendations, we use this company called Biotics Research. We support the use of their nutritional line. I've spent a lot of time looking at products. I just happen to like theirs the best. So our particular immune support recommendations, this is the same recommendations we've used for years. So it's not particular to coronavirus. I'm not telling you this will help you protect you against coronavirus, but this is what we recommend. The Bio-D Emulsion Forte is a sublingual droplet, so it readily is absorbed in the body. The Bioimmunozyme Forte is loaded with zinc and vitamin A, and then other proprietary blends of immune support. The Bio-C is a formulated vitamin C matrix that is quickly absorbed by your body, and then that ADP. If you have questions about this and you're a patient of ours, make sure that you take advantage of how to ask those questions. If you're not a patient of ours, I highly recommend that you talk to your healthcare provider before starting any nutritional supplementation and ensuring that there's not medical interactions or medication interactions that need to be known. So these are general recommendations. They're not specific to any one person, and they're not intended to treat any particular condition. What else can you do at home? Now is a perfect time to get moving. Even 20 minutes of exercise can both improve mood and increase your energy. So one of the things I've talked to people about, they're stir crazy, and part of that is they like, I don't know what to do, and I don't have enough things to keep me busy. And so we're encouraging people to start their at-home care and get into activities that keep you moving. Certainly to tolerance, and I know a lot of our patients have physical mobility issues or concerns that we're working on, but everybody can do something. And so we provide a couple of resources here. The first strategy is name a time, so set a time. If we wait until we decide to do it, it's not going to happen. So when you get up in the morning, plan out your day, include time to get physical activity in. And then YouTube has plenty of guided activities. Fitness Blender is a great free resource to help you find out home activities to do, and Do Yoga with Me is another great website for moving meditation and moving yoga type activities. Lastly, you got to take care of yourself. So self-care includes taking care of your physical body, your mental mindset, and then your spirituality. So we certainly are highlighting one of our basic and core functions here, which is chiropractic. And while we still have the ability to deliver that, we're here to help you with your chiropractic needs. Stress reduction, including massage therapy and muscle work, even if it's at home and you have somebody that can do some trigger point work or do some light muscle work. We know that creates relaxation and takes some stress off your body. And then we are providing essential massage therapy. So those of you who are under care and have myofascial or mild tendinous issues, certainly that's part of our protocol as well. And then we always stress that when your physical body is under greater stress, it puts your emotional body under more stress as well. So resuming as quickly as you feel comfortable to get back under the process of relieving pain, going through our physical therapy and physical medicine protocols. Our regenerative medicine protocols are designed to help promote healing and restoration of those injured muscles, ligaments, and joints. And so we know that taking care of your body helps reduce your stress and keeps you in a greater functional state. Which brings us to why are we still open? First of all, our purpose remains to provide high quality care in a safe and comfortable environment to help as many people as we can get and stay well from a natural first perspective. We remain open because we can and because we are considered an essential healthcare delivery system. That doesn't mean we haven't changed our practice. We have. We're following the heightened practice guidelines as recommended by the CDC and the Illinois Department of Public Health. And we are looking at essential care. We empower you to make the decision on what's essential for you and what's safe for you. So we certainly understand those patients who are pausing their care right now. And then we're strengthening our practice disciplines inside the office to make the environment as safe as we possibly can. So what does that include? It includes a virtual waiting room, meaning we're gonna ask that patients wait in their car, call us, and then once we're ready to start your treatment, we'll have you come on in. Every patient on the way in undergoes a brief questionnaire about the particulars regarding coronavirus, and then we're checking every patient on the way in for their vital signs, including temperature. And then we're turning away and unfortunately pausing care for those patients who present with COVID-19 signs, referring them to where they need to go to seek intervention for that, and patients who've traveled outside of the country in the last 3 weeks. We're asking those who've been in contact with a confirmed case to delay their care. And then we're also reducing the number of people in our office, including our staff. We've moved to a lot of work at home policies, especially for our administrative staff. And we're reducing the number of patients in the office at one time. And is friendly, and as much as we love to see everybody in the office, we have to practice our own discipline. So no hugs, no handshakes. And we're going to limit conversations to patient care needs only. So not to be rude, but just in a process of trying to eliminate unnecessary things in the car, in the course of your care. The other thing that we are doing, and it's not listed here, but we have hospital grade decontamination wipes. So we use antiviral, antimicrobial decontamination wipes. So all of our common surfaces are wiped down routinely. All of our chairs, all of our patient surfaces, such as tables and treatment areas, are all wiped down in between each patient. So, when we compare your ability to go to the grocery store or the convenience store, I certainly think we have a much higher threshold of sanitation and screening. And so we're doing the best that we can to create a safe and healthy environment for you. And then lastly, we have, it really should say, very minimal negative impact on the supply chain shortage. So our supplies do not impact those necessary supplies for the personal protective equipment needed on the front line. So, our procedures and things like this don't use that same gear. The only thing that we use are particular gloves and the cleaning wipes, but we've been able to get those, and those are not what they're asking for healthcare providers to limit at this time. So again, I'll leave this up just for a second. This is the website. That's a long one to jot down. It will be emailed out to you, but you may want to jot down these particular hospitals. And then, John, I don't know if you want to come back on. Were there questions that came about that need to be answered? And is there particular things that came through that we need to address?
Well, one of the questions that came up that I thought was important for people to understand is the question was, will this infection occur every year? Is this possibility that you can be reinfected? Now, they did do a study on some monkeys where they exposed them to the virus, and then at the end of the virus sequence, they did a blood test to see if they had an immunity, which they did, and they reinfected them again with the virus, and the second infection did not take. So after you are sick and infected by this virus on one occasion, most likely you will not be reinfected from this, and you will have an immunity. Now, there is a possibility of a blood test that will be coming out, which will indicate if you have the immunity or not. We're not sure when the availability of that blood test will be open to us. So once we know when you'll be able to receive it, we will let you know.
Yeah, and so that's a great point, John. And the other aspect of that was much like these other coronaviruses, right? The likelihood is every person on this chat, every person we know has been exposed to a coronavirus at some point in their life. This happens to just be a new version of that. That's why it's called the novel coronavirus. So the likelihood is yes, we'll have immunity to this particular one, and then we don't know as our world spreads, we get into new crevices and areas of habitation in this planet. We may be exposed to new viruses that do create that animal to human transmission, and then we're at risk for another outbreak. But that doesn't mean to scare you. It's just how these things happen. And this particular one, we should have immunity once you've been exposed. And as John said, we'll be able to test that with a simple finger stick blood test here in the coming weeks to months. So great question. Anything else?
No, not that I'm aware of. If anyone has any questions, please feel free to ask. You can always reach us at our office or online, and we'll be happy to answer any questions you might have.
Yeah, so that brings me to the last. Our office is open to provide that essential care. And then, but if you don't feel comfortable with that, but still have questions particular to coronavirus and how it impacts you, if you have particular considerations on your immune system and what you might need to do for that, or your treatment plan or home care or anything else that we can assist you with, we certainly have the ability to do telemedicine visits, which will be very similar to this Zoom meeting, where we can see you, you can see us, and we can go ahead and talk through that through this technology. If you have questions or concerns, please call Shana. She's our case manager. That's 630-923-7732. Or you can email Shana. Her email address is here. And then I'll close with a sincere thank you for all of you being on today. I certainly appreciate this. This was my first webinar of this format, so I apologize if it was a little clunky. Getting used to the technology, but I certainly hope that you learned something, and I hope that you have strategies that you can start to implement today to help you and your loved ones stay and be well. So our purpose remains to provide high quality care in a safe and comfortable environment to help as many of you as we can get and stay well from a natural first perspective. That's it for now. God bless and be well.